tears for a much-loved colleague, Dr. R.K. Himtani, killed by COVID-19 in the same hospital where he'd spent a year treating other victims of the coronavirus. Grief and the inevitable silent question, who's next? He died here in this intensive care unit because the Batra hospital where he worked ran out of the most basic necessity, oxygen. He was not alone. The medical director of the hospital, S.C.L. Gupta, gave the mid-afternoon casualty figures in this war against a virus.
8 patients died today. 8 died just now. And 5 patients, they are under resuscitation. May or may not survive. Just because in the capital city of Delhi and because of want of oxygen, which is the lifeline.
He knew the chances of reviving the 5 were slim.
When you heard this morning that you had just a few hours of oxygen and then 8 patients died, what does that do to you, to the soul of a doctor?
I cannot explain my feeling. We are dying inside. We are the saviors, not the murderers. And we cannot express our feeling to you. I cannot express my feeling to you, how I'm feeling inside.
Is it destroying you?
Yes.
How long have you been a doctor?
What, sir?
How long have you been a doctor?
45 years.
Must be soul destroying. I can't imagine what it must be like for you. I'm sorry.
I'm sorry, sir.
Over the next hour, 4 of the 5 resuscitation patients died.
In a space of about 2 hours, when the oxygen ran out, 12 people died in this hospital, which in every other respect is a first world facility. They simply asphyxiated.
The hospital copes by advising patients to source their own supplies of oxygen to cover its erratic supplies. Local and international efforts to get enough of the gas into India's capital are still failing. India's central and national governments have been unable to explain the oxygen shortages. And as the numbers of people infected with COVID-19 soar in India, along with the daily death toll, the Batra hospital, like many others, will admit no more patients. There's no point.
We will not take more admissions because we don't want people to die in front of us. So they can go to other hospitals where the oxygens are available.
Dr. Kishore Chawla runs a Hindu temple charity. He pulled through COVID before the oxygen started to run out.
From housekeeping, and even the nursing staff, the supervisors, all are working very hard.
Fair enough. But the Indian government's failure to ensure basic supplies to hospitals in the face of a long-term pandemic is simply not going to wash.
Now, Brianna, the central government continues to say that it's got this under control, but this is Rakesh here. He's barely able to speak his name, and he's totally reliant for survival on a charity's donation of this oxygen. But this is the view being expressed by the national government. Take a listen.
पर्याप्त प्रोडक्शन जितनी आवश्यकता है उसके हिसाब से कई बार आंकड़े दिए जा चुके हैं उसके हिसाब से सारे स्टेट्स को भी अलॉट किया जा चुका है उनका कोटा दिल्ली को भी जितना कोटा उन्होंने शायद मांगा होगा उससे ज़्यादा कोटा उनको अलॉट किया जा चुका है और उसको औपचारिक तौर पर दिल्ली के मुख्यमंत्री ने प्रधानमंत्री जी को थैंक यू तक बोला है
Now, John, the Supreme Court has now intervened here to force the central and state governments to up their game when it comes to delivering vaccines. And at the same time, the central government's just announced that it's going to be mobilising medical students to try to cope with this COVID pandemic. But it's most certainly on the back foot and trying to spin its way out of what is a humanitarian catastrophe. John?
Yeah, you can't spin your way out of people dying before your eyes, suffocating in the hospital because they don't have enough oxygen. He can say quotas are being met, but the quotas need to be higher, clearly, if it's not enough at this point. Sam, I know that a lot of countries are sending relief to India. Has it arrived? Is it making a difference?
Well, we've seen no evidence of it on the ground. These cylinders have come many hundreds of miles. There's no oxygen to be found at all in Delhi. We have seen the television pictures, as you have, of this aid pouring in from the United States, United Kingdom, Germany, France, Singapore, you name it, they're giving. And yet we're not seeing it hitting the streets at all. And in terms of the national government's argument that Delhi is getting more oxygen than it's asked for, is simply a fallacy. It's asked for at least 700 tons a day, and the other day, the last reckoning we had, there would only been delivered 490. So it's factually incorrect as well as politically bizarre, frankly.
Sam, I have to say, we're reminded once again the key element of public health is public trust. And once you've lost that, it's very hard to get it back, very hard. Really, really difficult to watch your report, Sam, and to hear from that doctor. Dr. Cooper, 45 years on the job, never seen anything like it. You can tell his heart is broken and he needs to keep on working. Our best to you and your team, and thank you for your reporting.
Yeah, Sam has really been some of our eyes and ears on the ground there in India. And I think, John, one of the things that is so disturbing about watching this is it feels like something that you might have seen over a year ago. But to imagine that they weren't prepared with oxygen, it just doesn't seem that there's no excuse for it.
And also to think about what might still be to come. You think about where we are in terms of vaccinations, almost half the country vaccinated. In India, that would mean 500 million people. They're nowhere near that at this point. This could get a lot worse.